Hey, I'm Ilo Ogwanemu, welcoming you to Ask the Doctor. Today on Ask the Doctor, we'll be looking at mental illness. According to reports, mental illness is one of the leading causes of death worldwide. According to the World Health Organization, 450 million people worldwide have mental illness. Well, to discuss more on mental illness or to introduce my guest to you, let's go on this short break. More of this when we return. I'll be back.
It is not good for man to live alone in this journey of life. Everyone needs a helpmate. African Broadcasting Network, your trusted partner, your family station.
Welcome back. If you just joined us, the program is Ask the Doctor. Our guest today is Dr. Edugbo Oronana, currently registered 1 in the Department of Psychiatrics, Delta State University Teaching Hospital, Desut, Ugara, Delta State. Dr. Edugbo, you're welcome to the program.
Thank you very much.
And it's nice having you today.
Thank you. I'm glad to be here.
I'm impressed about your profile.
Thank you for the compliment.
So, Doctor, what is mental illness?
Well, I'll start first by defining what health is. Now, the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Okay? So, when we talk about mental illness, we're referring to illnesses, okay, that have to do with issues that are resulting from the mind, okay, or that may be resulting from the body, that has an effect on, you know, the mental processes, okay, of the person. Okay, so that's just a broad overview of what mental illness is all about.
Okay, so what are the types of mental illness?
Well, the types of mental illness, they are quite much. Many times when people hear the term mental illness, they just feel that, okay, psycho, you know, the person is running mad on the street. But no, mental illness is much broader than that. We have mental illness that could be resulting from organic problems. For example, someone could have a maybe an accident, you know. Someone could have issues like, someone could have diabetes or even hypertension, and eventually have mental illness. Okay, so you have issues relating from that. You could have problems with substance use, you know, and there are different kinds of substance use. You have alcohol, cannabis, marijuana, cocaine, and all so on and so forth. You could also have people who have problems using. Now, the substances I just called now, they're what we call dependence-producing substances. In other words, when you start using them, you're not dependent. You know, yes, you depend on them. You know, but there are some people that use substances that are not dependent causing. You know, like some people use some kind of cough syrup. Yes. Okay. So, and some other substances. Some people like taking some people like taking some things that may not necessarily cause dependent, but you know, they abuse it. You know, abuse means abnormal use. Okay. So you could have those, it falls under the view of mental health to address those issues. You could also have people who have things like mood disorders, the different kinds of mood disorders. There's what we call depression, there's what we call mania, you know, and even in depression you have different classes of depression. There's mild, there's moderate, there's severe, and then in severe depression there's what we have people who have severe depression with psychotic symptoms. Okay, that is like the mad, you know, and then people could have severe depression without psychotic symptoms. Okay, and then people could sometimes have depression and mania, what we call bipolar disorders. You know, some people could be unipolar. Then we could also have problems like mental illness arising from child and adolescent. You know, that's seen in child and adolescents issues. We also have mental, what we call somatoform disorders. Somatoform disorders are disorders that, you know, have to do with, you know, things that, you know, the person is dealing with on the inside, but it has now is now beginning to, you know, show in his body. It could affect any organ in his body. You know, somatoform disorders, what we call conversion disorders. You know, there's what we call there are illness that mental illness could actually result from people that may not have any physical problem in their reproductive organs. You know, what we call gender disorders, gender identity disorders, and all that stuff. Sexual disorders, you know, that may not be due to physiological problems in their body system. So, you see that mental illness, it's actually very, very broad. Okay, but most times people just think about the psycho, psychotic, but it's broader than that.
Okay, so subsequently we're going to look at different types, as in we're going to look at different types of mental.
Different types, yes.
That depression,
depression, the mania, substance use, addiction, for example.
Okay, so what are the causes?
Causes of mental illness. Well, the causes of mental illness is broad. You could have mental illness resulting from trauma, for example. Okay, someone has an accident, a road traffic accident, maybe has an head injury, maybe was involved in a fight, and then someone hits him on the head, so it could result from trauma. It could result from infections. I won't say infections now. People can have severe malaria and eventually now begin to affect them, like severe typhoid, cerebral malaria, infections like HIV, tobacco.
Does HIV lead to mental illness?
Yes.
Why is it because the person is thinking of this?
No, well, in that, one would say it's been found that the virus has access to the brain, the human immunodeficiency virus, So we have HIV dementia. There's what called HIV dementia. Okay, so those are infections. We have several kinds of infections. Some can have severe malaria that's not treated, and then eventually begin to have psychosis and all that stuff. So that's resulting from infection. We could also have people who have what we call neoplasm or cancer. Certain cancers that affect the brain can eventually cause the person to begin to now show, symptoms that are suggestive of mental illness.
Okay. So what are the symptoms?
The symptoms of mental illness, it depends on the type of mental illness. For example, when somebody comes and we are seeing a person relating to who presents in our clinic, okay, from the presenting complaint or what the person says, he has, we're able to now, inquire more to find out what are the other issues that are there. For example, let's say someone that has a problem with depression. Someone that has a problem with depression, for example, now, you may find out that the person no longer, he becomes moody. He has a change in mood, Maybe someone that used to be jovial and outgoing, all of a sudden you find that he no longer talks to anybody. He's always reserved. He's always on his own, And then things that he used to do that used to interest him, he's no longer getting involved in those things, And then in some people, it can actually even affect their sleep. They are no longer able to sleep at night, or they begin to oversleep, And then some people, you find that they have. I should have even mentioned that there are a group of mental health disorders that we call personality disorders. There's a change in their personality. Wow. Yes.
Is it the one that we feel? Those kind of people who feel, I'm the one that owns this place, I own Central Bank, I own. Is it
well, that what you just mentioned now can actually be a symptom that may be suggestive of mental illness called what we call mania. In mania, for example, the person could have excessive energy, he's eating excessively, he doesn't sleep anymore, there's a change in his biological function, and so on and so forth. So when the person comes like that, we need to inquire more to know what, the problems, other things are, because even in those symptoms, sometimes they overlap, and then you need to be sure of what the person really has so that you know what kind of treatment you need to give to the person. When we talk about treatment, I'll talk more about that later.
Because according to research, from age 18 to 40, they are more prone to mental illness. How true is that?
Well, 18 to 40, yes, most people may actually fall, may actually have mental illness within that period. But the truth is that mental illness can actually arise, from even childhood. That's what we call, is what we call an aspect of as of psychiatry that we call child and adolescent psychiatry, which we actually need to even give more attention to, because it's really neglected, and there are so many issues relating to that. But even now, do you know that it's been found that even women that are pregnant, women that are pregnant, there's an aspect of psychiatry that is being developed right now, having to do with diagnosing children that are at risk of psychiatric illness right from the womb. Okay, so it's not just only within that age. We'll have geriatric psychiatry. That means people are age 65 and above, they can have psychiatric illness. So there's no age range, yes, but the bulk of people may fall within that age, but there's really no age range. You can have people having psychiatric. There's children that could have schizophrenia right from when they're small. And the thing about age, the age factor in that is that the earlier the onset of psychiatric illness, the worse the prognosis. When we say prognosis, we mean that the outcome of that disease.
But you know, if a child is having those kind of symptoms, the parents do not know on time.
Yes, they may not know.
Because there's a child, when we were growing up, when the guy was small, he used to behave strange. So people will think, yeah, maybe those kind of children that are grown now, it doesn't have sense because he's thinking that he's a big boy, right? He's a baby. Those kind of children has a fast growth. So he's just behaving somehow. We didn't know that actually that guy has a mental problem. Until when the guy was grown up, the parents don't know that the guy has a mental problem. So what do you think? Do you think the parents, how do you think parents will be able to watch out for those signs in their children?
Now, there's what we call childhood development. There's what we call psychosocial development. And you see, that's why people need to be more educated about, you know, mental health. Because when you see these things, you are able to now pick early signs. You see, the earlier you pick these signs, you know, the better, you know, because you are now able to now know what to do. For example, let's say a condition like depression. Okay, depression is one of the conditions in psychiatry that is treatable, because if you take the medications, you are definitely going to respond. You know, so but then people are unable to pick signs of depression, you know, either from their, you know, in their loved ones or, you know, even in themselves. And when we talk about suicide, we're going to talk about suicide, you know, but you know, one of the leading factors that contribute to suicide is actually depression, and depression is treatable. So you see, the more people are aware about these things, the better, you know, because you can actually prevent suicide. You know, there's so many things, and then even the person's effect on work. You know, neuropsychiatric condition is one of the leading causes of disability worldwide. You know, so you know, the earlier we're able to know, the more we are informed, and we're able to pick these things, we can be of help to our loved ones. Now, recently, I discovered there was a news that came, I think, a couple of months ago, about a lady. She was one of the top leading staff in the local government, and she committed suicide. You know, the question was, money was not the problem, obviously, because your husband was a top university staff, you know, and of course she didn't have a problem, but she had conditions. She had hypertension and diabetes, and the thing is that very likely what must have led her to commit suicide would have been depression. So is it that the loved ones were not, you know, around to notice, you know, the changes, you know, and all that stuff, the mood and all that stuff? And also when we talk about, you know, caregiver, you know, emotions and all that, how you relate to the person, and all these stigma issues. So
when you talk about that,
so
who is prone to mental illness? Is it the male or the female? Or okay, let's come to Africa. Who is prone to mental illness? Is Africa rate higher than that of the American or Nigerian rate higher in Africa? So who is prone to mental illness?
Well, both sexes are prone to mental illness, but you see, for us in Africa, we don't have accurate figures. We don't have accurate figures, but that question is actually very general. It's very general, you know, because there are different kinds of mental illness. For example, let me use suicide and depression. For example, it's been found that women commit suicide. No, I'm coming. It's been found, in terms of suicide now, okay, it's been found that women have the highest number of attempted suicide. There's a difference between attempted suicide and completed suicide. Let me use that term, completed suicide. Okay, that is the people who actually go ahead and really commit the suicide. Men are more in number, but some who attempt suicide will still eventually be alive.
Okay, well, you see that mental illness. So
there are issues that must have led that person, okay, to want to commit suicide. Okay, and even in terms of depression. In terms of depression, women have been found, you know, to have a higher, you know, they've been found to be more, you know, in terms of depression, the depressive conditions, okay? But there are issues, when in the research, there are issues that are being raised. That is it because women are easily able to present to the hospital, you know, for them, you know, to be seen, because you cannot assess somebody, you can't look at someone and say, this person has depression. No. There are criteria for depression, and of course, like I said, there are different levels of depression. Okay, so there are issues relating to that. And then secondly, there's also a saying that also it's possible that the, women's hormonal changes, you know, because of that period, could also lead to some of these things, and their inability to handle their environmental conditions. So these are some issues, research issues that are being looked into presently.
We'll go on a short break. More of this when we return.
It is not good for man to live alone in this journey of life. Everyone needs a helpmate. African Broadcasting Network, your trusted partner, your family station.
So, doctor, is mental illness hereditary?
Well, studies have shown that they've been able to locate for a couple of the mental illness, for example, schizophrenia and alcohol use disorders. They've been able to locate a gene in the chromosome that is related to those conditions. Now, also, through research, it's been found that the contribution of mental illness in terms of genetic and environmental factors, they will call environmental factors and genetic factors, they are about equally the same in studies that have done so far. So there's a genetic component, but research is still on concerning the other, like mental illness. They are quite broad. They're still doing quite a number of research now to find out, to locate, genes that might really be directly related. But so far for schizophrenia and alcohol use disorders, they found issues, genes that are associated with those conditions.
What about men that abuse women?
Men that abuse what's called spousal abuse.
Yeah.
Well,
because I know that as a mental illness, if you ask me.
Well, like I said, you need to do a lot of investigation. You need to talk to really find out. You really cannot label somebody that because there are issues that you need to find out. So we can't say that's genetic anyway.
So let's talk about diagnosis.
But sorry, if I may say, sometimes there's what we call comorbid conditions. Sometimes two or more psychiatric illnesses may coexist in a person. Sometimes people that have what we call general medical conditions like hypertension, diabetes, and so on and so forth, HIV infections, they may also have psychiatric illnesses. So alcohol use disorders and all that. So you need to look at it. It's a holistic thing.
Okay. So let's talk about diagnosis. How can it be diagnosed?
Well, in diagnosing mental health conditions, first and foremost, apart from the complaints that the person may come with, you need to ask some other questions that can help you to have insight into what specific kind of problem that the patient has. For example, people that have someone that has mania, or there's a mental illness we call mania, may have psychotic symptoms. Someone that has schizophrenia may also have psychotic symptoms, but it's the components of what is in there that will not help you know that is this mania or psychotic symptoms, is this a schizophrenic condition, or is this a schizotypal personality? Because there's what called schizotypal personality, under personality disorders, and even sometimes people that have depression, you could have depression with psychotic features. So apart from the questions that you ask, there's what we call the mental state examination. The mental state examination, you need to, from when the patient walks in, you're looking at the patient's appearance, his behavior while you're talking with the patient, his mood while you're talking with him. You can even ask him. Yes. Like I said, I'm sure your mind is still going to the psycho stuff. You can also all dressed up in suits, and the guy has, he has probably depression. Or could have a personality disorder. Someone that has personality disorder might sit quietly and be looking at you. But when he has maybe a schizoid personality or what we call paranoid personality, that will suspect everybody. So there are issues. Or someone that has an alcohol use disorder might dress and go to work in the morning, but in the evening he goes home and he's drinking himself to stupor and all that stuff. So you do what we call a mental state examination. You assess all of those things. You look at his cognition, his orientation. Is he oriented where he is in time, place and person? You look at his memory, his long-term memory, his short-term memory. You look at his sense of judgment by asking him some questions. You look at his insight. Does he have insight into what is going on, what he feels he's experiencing? And then even when you are trying to find out what illness type of mental illness the person has, you also need to look at the person's past medical history. Does he even have a family history of a mental illness? And then sometimes, let me just say this, that sometimes in some of the conditions you might need to corroborate what the patient tells you. But you see, when you're talking to someone that may have a mental illness, you need to talk with the person, because in his talk, for example, his speech might not be coherent. His speech might be out of line with what Am I communicating?
Yes.
Okay, so you assess his speech, you know, you assess his thought patterns. There's what we call abnormalities of thought, you know, thought patterns. You assess his perception. Okay, does he have an illusion? You know, does he, you know? So, and then also even in his history, in his personal history, you need to go into from his child, from when he was conceived in the womb, you know, to when he's born, after he's born, because sometimes you find that, now there was an issue we treated at the time. The lady had the problem with her mother because the woman, because her husband wanted a male child. I think she already had like three females, and when she took in, by the time she delivered, it was a female, and the man was so angry, and he you know, he vetted his anger on her. You know, he changed his behavior towards her and all that stuff because he felt she was giving him, you know, giving him a female child. And then the woman transferred. There's what called she transferred. It's what called defense mechanism. She transferred that aggression on the child. So right from when the child was small. So when the child grew up, and then unfortunately the child began to bedwet, and sometimes bedwetting might actually be an indication of a poor relationship between the child and the parents. Yes. So
it's a mental problem. Is that a mental problem?
The bedwetting is treated by mental health practitioners. Yes, it's falls under the purview, because bedwetting is actually a symptom that there's something wrong somewhere. It might be a symptom that something is wrong somewhere. So you need to find out. Okay, but it falls under the purview of mental health. So she vetted the anger on the child, and the child developed she hated the mother. In fact, it now got to a point whereby they couldn't stay in the same house.
Wow.
And one thing led to the other. The child became psychotic. She'll hear voices, you know, she'll see things that other people are not seeing, you know.
Because people say, in Africa, people will say that's spiritual.
Now, if you trace this lady's issue, you find that it's coming from somewhere. Why would the mother vent anger on the child? But you see, there are so many issues. When we talk about treatment later, you see that in treatment there's a lot of, it's not just drugs. Yes, it's not just drugs. So this lady, eventually, she couldn't stay in the same house with the mother, and a friend had to come and take her.
Can mental illness be prevented?
Well, that's a very good question. Now, mental illness, right now, the thinking, you know, globally is focused on prevention. It's focused on prevention. That's what I mean. We're talking about preventive mental health, okay? And there are so many things that we can do to prevent mental illness. It can be prevented, okay? Like I did say, the causes of mental illness helps us to now know what preventive strategies to adopt. For example, if our roads are safer, if we have good roads, we prevent car accidents, okay? We prevent more people going to have brain, road traffic accident, brain-related road traffic accident, some of which can actually predispose to mental problems. We talk about other things like the regulation. Now, I just did the course with King's College, in terms of alcohol, drug addiction, and all that stuff. And you find that they are employing so many strategies, to be able to reduce, the people that are already addicted. And we'll talk about even government regulation of those kind of substances, alcohol and all those stuff, cigarette and all those stuff. So the addiction is another very, 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 very big topic. So the preventive strategies are very many, from educating, public enlightenment, mental health advocacy, of which Winning Health Initiative is, is involved in, the organization that we are doing right now. It's involved in. From advocacy issues, and advocacy is quite broad. You talk about advocacy not just to the public, but advocacy to the government officials, and all that stuff. So it's a broad thing. Then apart from advocacy issues, we now also talk about, there's what we call all those things fall under what we call primary prevention. Okay, so prevention, it's quite broad. Even in treating mental illness, sometimes people could not have access to the drugs that they are taking, and then there's what we call relapse. So let's say, for example, now you're treating the case of psycho, which most people are used to. There are certain drugs you can give, and then you see the person will improve and doing well. We've had a number of beautiful cases that we've handled, in our center.
Can they get better?
They do get better. Now, research has shown that a third, they get better and may no longer need the medication. 1/3 will need to depend on the medication, provided they have the medication to take. Another third may not respond to medication. So you're not going to say that, for the 1/3 that will not respond, because these are confirmed research. Okay, they wanted that will not respond. You will not provide drugs or provide treatment for the other groups, because it's been found that it said, you know, 1/3 of all this, yes, that's the response rate. And then for issues like depression, for example, people that are depressed, they respond very well. We've had patients who were treated on severe depression, and today they're not presenting in clinic. You know, that's,
okay,
that's
but
right
now, what kind of medical facilities can handle such case?
Now, right now as I speak, a good number of our healthcare providers don't really have that exposure in terms of training. Okay, which means that we need to look at training more, to train people at the primary care level, because fine, that doesn't mean they didn't do some exposure while they were in training in their institutions. They did, but it's not adequate. If you compare the number of persons who are mentally ill to the number of manpower, is grossly inadequate. Even we talk about even general illnesses itself, and in our own country, it's grossly inadequate. So we need to train people. That's why we're talking about the World Health Organization is talking about the mental health leadership and advocacy program, to encourage people, to expose people more to issues about mental health and advocacy and all that stuff. There's one coming up in Nigeria in the month of July, I think July 21st to the first week of August, that's coming up, and whoever is interested may want to be involved in that. So there are training issues. You see, if people are trained, they can actually provide at least basic health care. When these things don't respond, you cannot refer to a higher level, you know. But you see, people can be trained. In fact, in what's being done in some areas now is they're even trying to see how they can even use what we call the GSM, GSM related technology to be able to provide care, you know, because people cannot access. For example, now we have a center, the center where I work. How many? We don't even have basically a psychiatric center, you know, within the state. Okay. But
okay. All refers to.
Now, what I mean psychiatric, like for example, we talk about Federal Neuropsychiatric Hospital, you know. So in
the country as a whole, how many psychiatric hospitals are there?
I can't give you an accurate figure right now.
But do we have more like the do we have more?
We don't have any new ones coming up. It's just the ones that were established long time ago, you know, that are still there. But of course, we have psychiatric departments in teaching hospitals. Okay, in some general hospitals you could have a psychiatrist there, you know, but more still needs to be done. You know, for example, while I was in training, we knew that most of the patients that were presenting in our unit were coming from not necessarily from Delta State, you know, and if we, like our response rate in the clinic basically that we've run so far, we've seen a tremendous increase in the number of patients that come. And that even with the amount of awareness that is as low as it is, for us to have that kind of response, like people who have responded, they've gone to tell other people that the nice psychiatric center, and they are now coming. So
can a poor man afford such care?
You see, it depends on. Now there are some cases that you might need to institutionalize, that is maybe admit, okay, but there are cases that the person needs to come from home. In fact, right now the emphasis now is that they are de-emphasizing admitting people, as it were, but that doesn't mean we shouldn't have space for admitting people. In fact, the thinking now is that why don't you create wards in the different general hospitals, you know, where people can, you know, have care, you know, and even if, let's say, they don't have a psychiatrist, as it were, is it not possible for us to have a psychiatrist visiting these places or running a clinic, or by the time we do trainings for the doctors in those areas, they can now know, you know, what cases they need to admit. So these are issues we need to look at.
That's how we wrap it up on our favorite program, Ask the Doctor. Let's know what you think. Our numbers and email address are showing on your screen. So I come your way next time and email or go name saying health is weight. So take very good care of yourself and live a healthy life. So I come your way next time. God bless you.